if people find out that that's what I'm doing and that's what's going on, then so be it. Because I found myself in a very grave situation being a patient at such a young age. And that's now part of my journey. That's part of my life. And I stopped hiding.
And what did that feel like once you made that decision and you started to share more openly with your patients?
Liberating for me, empowering for me too. Because then I was able to infuse all the things that I learned and all the things that I was frustrated with into how I think about patient care and what my patients are experiencing.
Hello, and welcome to Pursuing Health. I'm Dr. Julie Fouché, family physician and former CrossFit Games athlete. Here, I bring you information and inspiration to help bridge the gap between fitness and medicine and support your journey toward your healthiest self. Thank you so much for joining me. Now let's get started with this week's episode.
Welcome back to Pursuing Health. I am very excited to be here today with Dr. Jaclyn Tolentino, who is the lead functional medicine physician at this flagship location of Love Life in Los Angeles. And if you're watching this on video, you wouldn't know it because we're on two separate videos and computers, but I'm actually here with her, and she just gave me an amazing tour of Love Life. And so I'm excited to talk more about that as we get into the conversation. But first, just a brief intro, a little bit of information about Dr. Jaclyn to get us started. She is a board-certified family medicine physician. She subspecializes in hormone optimization. She graduated from the Edward Via College of Osteopathic Medicine with the Doctor of Osteopathy philosophy, which laid the foundation for her holistic approach, treating the whole person and empowering the body's natural ability to heal. She did her residency in family medicine and then subsequent training through the Institute for Functional Medicine, and is also certified in advanced bioidentical hormone replacement therapy. So after this amazing tour that we just had, Dr. Jaclyn, it's so incredible to think that you get to work in such a collaborative and life-giving environment. I'm excited to share more as we get into the conversation, but I would love to just start with your story. So first, I just want to welcome you and thank you for joining me, and thank you for taking the time to have this conversation. And then maybe start from how you decided to pursue a career in medicine in the first place.
Thank you, Julie. I'm so happy that you're here, by the way, and actually getting to do this, even though we're in the separate rooms, but being able to experience Love Life even just a little bit. So thank you. And thank you for having me. It goes back pretty far. I was definitely one of those kids who really was fascinated by science. But by the time I was in college, I still didn't know what I wanted to do. So I went ahead with a health sciences background, knowing that it could, at one point in life, amount to something in the medical field. So whether you decided to do nursing or OT or PT or a doctor, you at least had a lot of those basic foundational science classes in check. It still wasn't 100% until after college, I decided to move to Naples, Florida, over on the west side of Florida. And I lived with my brother. My brother is a lawyer. And at the time, he was just continuing to start and build his career. He's about 10 years older than me. And he said, you know what, Jack? You don't know what you 150%, want to do with this health science background. But if you come to Naples for the summer, you could always just get a job at a doctor's office and decide for yourself if that's something that you could see yourself doing. And I took him up on that offer. So I left Gainesville. I went to University of Florida, left Gainesville, moved to Naples, and worked at a doctor's office. Now, it wasn't just any doctor. It was an osteopathic doctor who was just building out his career. And then that's how I learned about osteopathic medicine, about the body's innate healing abilities, about how all of our body systems are interconnected, and valued that. So I was his front desk gal. I was checking in patients and doing insurance and authorizations, but he always knew that I might have wanted to do something more and was using this as almost like a test pilot for if this was for me. Whenever he had interesting cases, or he'd want to introduce me to somebody that, had a really interesting case or diagnosis, he would. And he kind of showed me more of what osteopathic medicine was about. And so because I loved that philosophy, I decided to take some time off of that job and study for the MCAT and take the test and kind of move in that direction. And it was a perfect segue to where I feel like I am now in my career when I think about functional medicine and root cause and the interconnected body systems and working with a truly integrative care team. It all comes full circle from, really making that decision, a couple decades ago.
So wild and so interesting how the people that come into our lives or the experiences then shape our own path. And even how you had someone who was willing to show you more of what that osteopathy background looked like, because that's not always the case in the conventional system. So can you share with people who maybe don't know what osteopathy is, or like the difference between the two allopathic and osteopathic approaches?
Yeah, very simply, there's, two governing bodies when it comes to medical doctors in the United States. One is allopathic medicine, so traditional medical doctors or MDs, and the other is osteopathic doctors or doctors of osteopathy, so the initials are DO. What I loved about osteopathic medicine for me was really the number one, the body's innate ability to heal itself is one of the core tenets that goes along with that Hippocratic oath but takes it a step further. Number one, do no harm. Number two, really trust that the body can heal itself. And then another important tenet that is more along the osteopathic side is every body system is interconnected. There is a healing modality that's also supportive of that called osteopathic manipulation that goes along the musculoskeletal system. So that is also part of the training. And some doctors still continue to use manipulative medicine that is really related to musculoskeletal fitness. They do use that as part of the family practice model or the internal medicine model. And then some go on to continue paths in all different directions, just like they do in allopathic medicine, whether it's surgery or anesthesia or every other kind of subspecialty that you can think of. There is the world of osteopathic doctors continues to expand with those core tenets. When you know that the body truly does have that innate ability to heal itself, that infuses the education model. So even when it comes to osteopathic doctors, that is always something that's underlying the learnings that most of the medical students have.
Come back, I might have done it differently. Once I really learned and understood the philosophy, I felt so much more aligned with it. And luckily in my residency, it was half DO and half MD. So we actually had a lot of opportunities to learn from our DO colleagues, and they would try to teach us some simple manipulation techniques, although, there's a lot that goes into it. So an hour every week or two, you can only learn so much, but
Yeah.
Amazing. So then how did you go from, okay, I'm going to pursue this route, I want to become a physician, to family medicine? How did you decide on family medicine as your specialty?
For me, it was when I took a step back and thought about where I could see myself. I wanted to stay open-minded in med school, but that was so hard when I was working for the osteopathic doctor who was cultivating his career because he was a family doctor, and I loved that. What I loved most is the fact that you could see multiple people at different ages and that you could see whole families and grow with them. And that meant that I could see them as, a young couple early on. And then I could also see that they had additional family members, maybe a baby or two, and also see their grandparents. So to me, I was very much rooted in this mentality that I wanted to be a family doctor and I wanted to be able to see full families. When I went through all of the different rotations, I rotated at some pretty incredible places. But I always stuck to family medicine. I rotated at Mayo Clinic in Jacksonville. I rotated at University of North Carolina, Chapel Hill. And through every rotation, I still kind of came back to this concept of wanting to be a family doctor and wanting to be there for every different age and every different part of the family. And that stuck with me. And I don't know, when I went through the surgical rotations, of course, I was curious and try to be a part of that. But I still kept resorting back, Julie. I was like, this isn't quite for me.
It was pulling you.
Yeah, I still kept pulling back to wanting to go into family medicine. So for me, that was always like the North Star, is that even though I was open to these other opportunities and looked at surgery and looked at specialties, I kind of went back to this concept of the family doctor is the home base. The family doctor is the one that you're going to talk to the most outside of everybody else, that you're going to build and cultivate this relationship with. So that was an important thing for me.
I love that. Yes. I likewise, I didn't know that off the bat, but once I figured it out, nothing else really stood up against family medicine. And for me, it was the same approach. It's this idea that you really get to care for the whole person, the whole family. You're the first person that they come into contact with the healthcare system, and get to kind of hold their hand and help them navigate some of these things that can be really scary. So
yeah,
I totally appreciate that.
Yeah.
So you finished residency, and what was your practice like initially as a family doctor?
Yeah, so I did my residency in Miami. You can only imagine a family practice residency in Miami. We were also seeing, I worked in the city. So part of my residency was to work in the city, and we were seeing some really tough crowds and people who are really struggling with chronic disease. And once I finished residency, I joined a multi-specialty practice that, interestingly enough, offered cardiology, an integrative doctor, an infectious disease doctor, and then rooted in that was the primary care, the family practice and internal medicine doctors. So going from inner city, type of residency to jumping into this multi-specialty practice, it was quite the transition, because we also had everybody in-house. And so I had this experience on a different level now that you have me like talking about it and reflecting on that, considering where I am now. But it was beautiful. It was beautiful to be able to have the specialists right then and there. It was great to be able to collaborate literally with each of our patients. And I really enjoyed that. That part of it I loved. The tough part of it was what ensued throughout the course of that career, because I was practicing concierge medicine in this practice, and then I got sick with cancer. So that was really like the crux and the turning point for me to reflect back on how I'm practicing, how I'm living, and wanting to literally, shake things up and make some changes for myself.
Wow. Yeah. Talk about a major inflection point in your life.
Mm-hmm.
You are practicing as a family physician in this multi-specialty practice, which I'm sure was very busy. And then you find out how old at this point, you find out that you have breast cancer.
Yeah, I just turned 33. And that was it was such a hard experience, because you're in this practice, you're practicing this kind of medicine, and you don't realize that you need to tend to yourself after you have such a shocking diagnosis. It really makes you reconfigure and re-question and think about how you're working and how you're living. I also didn't find the cancer on myself. My husband was actually the first one to find it. So we were playing on the beach and he was tickling me. He hit my boob, he hit my breast. And then he was like, I think I felt something strange. And I'm like, you did? Really? And so he is the one who actually found it first. And then, you go through all of the tests and multiple doctors. You finally get that diagnosis, and then your mind is then taking over in regards to all of the consequences and things that kind of go along with a diagnosis like that in a young woman who is also still thinking about family and thinking about fertility and thinking of just, what am I going to do? So, after I went through my treatment, I had a double mastectomy. I also ended up doing chemotherapy for about 6 months. Lost my hair, lost everything. I was down to like 108 pounds, got real skinny. And I remember telling Charles, it was one more chemo left. And I told my husband, I said, I don't know if I can do this. I think I want to stop. This is really hard. But I had already gone through so much. So I literally was pushing myself to kind of finish things off. But then at the same time, you're like, okay, there is more to the story. There's more steps. You then are going to go on hormone suppressive medications. And it's almost like a chain, right? You follow these steps. There's all of these treatments. And for a young woman with breast cancer, it's a never ending story. From one treatment to the next, there's always something else. The last treatment, you get put on medications to suppress your hormones. And what sucks is that I was a young woman in my early 30s going through a chemically induced menopause. And that was hard. That was really hard. It was hard for me personally with symptoms. It was hard, in every way. I really struggled with that. And then I decided that even if they say, you need to be on meds for 5 years. Oh, sorry. The guidelines are now 10 years or whatever the case may be. I really wanted to just work on myself and get as informed as possible and make decisions for myself. And so I needed to dig deeper into the kind of medicine that was going to help hold my hand after this really big experience of diagnosis, treatment, surgery, chemo, and then what? And I think that's where a lot of women are really struggling with health. They might go through something and then there's and now what? and now what's next? What do I do? Who's going to help me with the next part? How do I heal from this? How do I recover? And at the time, I just felt like my care team wasn't the right care team that was going to help me on that next phase of my journey. So, I was very grateful for all of the treatment and the support I had at that time. But as a clinician, I also knew that in order to understand what was happening in my body at the time of the cancer, or even for the 10 years before, I had to do a lot more education and training to get me to a really comfortable place to be able to talk about it with myself and my family, to be able to reflect on that, to be able to talk to my patients about it, and also just decide for myself, do I still want to be the doctor that's seeing 20 people a day, 5 days a week, working the weekends? Or do I need to self-reflect on something that's really going to support my own well-being and a better type of medicine that I can offer people as I continued my own learning? So.
Wow. So much there. And that was clearly such a inflection point for you, not just personally, but also the direction that you then took your career because of what you learned through your own experience.
Yeah.
I'm always curious about what it is that leads people to take a different approach or to say, why, or what are the root causes that I can look for versus just accepting, especially being someone who's in the medical field, just accepting this is the standard of care. And then, I'm going to keep doing what I'm doing. What was it for you, or where did that voice come that was like, I have to keep searching. There's something more that I can learn about myself.
Thank you. That's such a good question. I remember one very specific moment walking out of the oncologist room, and she said, you know what, Jack, you can go back to living your life the way that you did. We cut the cancer out. You went through treatment. You're on medicine to suppress your hormones. Now you can go back to living your life the way that you did. And that was the turning point, because my husband was actually even in the room with me for that, last conversation that I had with the oncologist. And we left and we both looked at each other. And I almost at that point was frustrated because I was also scared that if you logically go back to, quote, living your life the way that you did, that was also a body that was created this hospitable environment for cancer to thrive. And I just knew that I couldn't do that anymore. And that meant taking a really hard look at my career, how I was practicing medicine, what time I was spending on my own self-care, and then wanting to dig even deeper than what I could find in traditional family medicine and in traditional oncology. And the more that you dig and the more that you look, you're like, okay, do I stay the same? Do I change? Do I stay the same and continue this possibly vicious cycle of one day coming back to the oncologist's office 2 years, 4 years, 5 years down the road, and then you might have cancer again because you didn't change anything about how you lived? Or do I do my own digging and my own research and help myself understand the physiology a little bit better. So I chose the latter path. I don't know where I would be if that was, the path that I continued on. And I used my own experience as a way to just really explore and stay open and curious, because I also knew that there were so many different kinds of medicine and healing modalities out there that could be very supportive. I just needed to spend time learning it, absorbing it, being amongst the people that celebrate it, etc. And I then took a job at Parsley Health, which was in Los Angeles. And at the time, they were just continuing to like blossom, right? But this concept of root cause medicine and helping people understand why they're sick and not just the 15-minute appointments, that was inspiring to me. It's inspiring to think about health in that way. And that was really like me and Charles deciding, do we want to stay in Miami and practice this way? Or do you want to take some time to really just focus on what you really want? And let's find the best place that is as progressive as possible to help you explore that. And at the time, it brought us to LA.
Amazing. Wow. And here you are. And also how hard that is. Like you said, do I want to change? Do I want to stay the same? It's also takes a lot of courage to branch out, like you said, move across the country, a totally new way of practicing and jumping into that. But just saying, I want to surround myself with the environment and people where I can learn everything I can learn and grow and practice medicine in a different way. That's amazing.
It was scary, Julie. It was really scary. I mean, when I first took the job, I was on a 90-day trial, just to see if this was going to be a good fit for both parties. And I immediately knew it the minute that I started practicing that was the path for me, was to practice more with an open mind and heart and, be so rigid. And, all the learning that I had amassed in those couple of years in between the transition, that was important. It was an important inflection point in my career to just make that decision and say, you took this latter route and you're just going to run with it and go with it and see where it takes you.
And then, you have that feeling that it's the right move and good things come from it, and it just gives you more momentum to keep going.
Mm-hmm.
How did I think a lot of doctors don't become patients with such a serious diagnosis at such a young age, but I have to imagine that experience of going through treatment also changed just that perspective, changed a lot the way that you empathize with patients or the way that you practice. How do you think you're different as a physician, aside from the root cause approach, but just how do you think that you are different as a physician now, having had that experience?
Yeah. Ooh, tough questions. That one was a tough one because I remember deciding for myself if sharing my cancer story was going to be something that I even shared at all.
Yeah.
Because you always think of patients like a huge decision. But for a lot of it, it was also almost unavoidable that people were going to see me in a different way. I had lost a ton of weight. I was also wearing a wig to work. Was going home, taking the wig off. All my hair was falling out, all the things. And it was tough to decide, do I continue to keep hiding it and holding it? Or do I just release myself from it and say, you know what? This is me. This is my experience. This is where I'm at in life. And I'm not immune to getting sick. And that's okay. So of course, holding on and hiding versus being open was also a bit of a process of a decision on whether or not you share. And when I did my own self-reflection, I just needed to release myself from holding so much. And that meant saying, you know what, Charles, if people find out that that's what I'm doing and that's what's going on, then so be it. Because I found myself in a very grave situation being a patient at such a young age. And that's now part of my journey. That's part of my life. And I stopped hiding. And
what did that feel like once you made that decision and you started to share more openly with your patients?
Liberating for me, empowering for me too, because then I was able to infuse all the things that I learned and all the things that I was frustrated with into how I think about patient care and what my patients are experiencing, because I had actually been in a place where it was one of my lowest moments in life, when you release yourself from something like that and you decide to show people who you really are, it is very freeing. It is very liberating. And even now, when I talk to patients and they ask me those types of questions because they're curious about my own personal experience in life, not just my professional career, I'm still open about that because life is hard and I had been through something very, very traumatic that I've also am still continuing my journey to continue to heal from. But there was a lot of learning along the way. And that meant seeing new practitioners, being open-minded, learning about different healing modalities, learning about root cause medicine, really taking a step back and saying, what were you doing that would cause cancer to thrive in that body? Talking to my mom, talking to her about our family history, talking with my dad. It took a lot. And I'm still at the point where I'm on this journey. And, I never think of it as like, oh, you're done. It's finished. It's more like it's evolved and it continues to evolve with time. And the more that I continue to build confidence in what my body is capable of doing, I just continue to kind of press forward on that journey and evolve in a way that also makes me feel really good. It is not perfect. There's always bumps in the road. There's always hesitancies, but it's important for me to do my self-inventory, to see my doctors, to feel at peace with what's going on in my body and my life, and also just feel like I'm on the right path. I think building the confidence with a care team you trust is huge for a lot of people. And that's one thing I think is also really important for anybody that's on a chronic disease journey. Because there's nothing like going to a doctor where you're trudging to even go, and then you leave feeling deflated, overwhelmed, gaslit, or, you have a ton of symptoms and you still don't have answers. It really should be a collaborative thought process so that people can understand their bodies and they also are coming to somebody that they really do trust.
And I imagine your patients have even more trust with you, just knowing that you've also been in their shoes and you've navigated, really difficult diagnoses and treatments. And there's nothing like, figuring out or going through it and having that firsthand experience. What were some of the things, as you then did more digging for yourself on root causes, what were some of the things that you identified? And as a result, how is your day-to-day life different today than it was before you were diagnosed?
Yeah, I had to do a lot of work. A lot of work. And that meant when I did the digging, I was like, oh boy, there's actually a lot that I'm uncovering. For example, when you first step into the world of root cause medicine, you learn about the gut microbiome and gut health. And I was never somebody who had a lot of bloating or gas or pain or burping or problems like that. But I had a very crazy diagnosis at a young age. And I thought, okay, let me learn more about this gut microbiome and what exactly it does. Now, in traditional medicine, nobody talks about that. It's not talked about. You say those words and people might not understand what you mean. Even though for you and I, it's like day to day, right? And the more that I learned about the connection to the brain, the connection to the immune system, how important it was to absorb the nutrients that my body needed to thrive, that was my first stop, was learning about that. And my husband and I, we both did one of these tests where you mail off your poop back to the company and you look at, these diagrams and these results. And we were both joking and I was like, you know what, Charles? I don't have any of those symptoms. My gut's going to be fine. It's going to come back great.
Perfect. Yeah.
And then he was like, we'll see, we'll make it a little bit of a competition kind of thing. So then we mail our test back. we both received the results. I'm like, okay, what does mine say? And it was one of those percentage ones where, depending on like, what your score was in terms of the ecosystem and the diversity and all of that, Charles is like, mine's at 90%. See, I'm doing so good. My gut's great. And I was like, oh, that's awesome. Let me check mine. Mine, 10%.
Oh, man.
So then I'm like, how is it that my gut's at 10% and Charles is at 90%? And so then I was like, obviously, is the test wrong?
Right, let me repeat this.
Right? And then I repeated it, and I still had a gut that was very dysbiotic, that didn't have a lot of support. So then I was like, okay, I know that the gut is connected to my immune system. I know that it's connected to the brain. Let me take a look at what I'm eating, and let me take a look at how I've been eating for the last 10 years. Because when cancer starts as one cell that decides not to die, and it grows into a mass that's large enough to palpate, we know that this is roughly 5 to 10 years before it's actually palpable. And so I thought, okay, what was Jaclyn like at age 23? I was stressed. I was 60 pounds overweight. I was, starting medical school and, staying up super late with pizza and carbs and inflammatory foods. I was on birth control for so many years. I wasn't living the right life that was, conducive to like this like anti-inflammatory thriving state. And I didn't know it, right? So then I had to like think about this evolution of, why would my gut be so bad now? And I thought about the medications and the birth control. And I thought about the lifestyle. And I thought about, being under so much intense pressure to continue to make it through to get to residency and all of that. And when you take that step back and you like take a hard look at your life and you do inventory of all the things that contributed to that state, then I was able to say, okay, now I know why this gut test is showing me that this is such a problem. I need to increase my fiber. I do need to support how my digestion is with the digestive enzymes. Maybe I needed to consider a gut healing protocol, which I did early on, that included certain targeted herbs to help support how this gut microbiome needed better homeostasis. And I had done a couple gut healing protocols in that time window between finding out how bad things were and then, wanting to really change things. So the foundation was awful. It was inflamed. There was a lot of concern. And then I was like, let me now also sharpen the pencil and refine how I'm eating to make sure I'm always having really good inputs as I'm supporting healing the gut. That was the first thing that came to mind in terms of like my bigger learnings, my bigger aha moments was, you need to do better with your gut health. The second one was taking a look at how my hormones were being metabolized. I was a woman who was on birth control for 15 years and all the way up until the diagnosis. And then once the diagnosis happened, I was like, wow, 100% need to get off of this. We also know that my breast cancer was hormone positive. And so when I did digging in functional medicine and root cause, you learn about how estrogen, too much at the wrong time, recirculating in your body can create more inflammatory response, can contribute to damaging your cells. And I wasn't sure at that point. I wasn't really convinced that just knowing that was enough. So then after I focused on the gut healing, I also did testing that also showed me how my body was metabolizing hormones. What I learned was that it also wasn't doing it so well at all. And I was a woman who was circulating and recirculating a lot of estrogen back into my body. That made sense to me because I knew that the gut was a mess. And so when the gut is also a mess, there's also certain types of bacteria that also support that awful job of recirculating estrogen and recirculating trash back in. And that was also eye-opening for me as well. It was a different test, different modality that was showing an inflammatory response in my body that I needed to support better. We know there are certain foods that help us do that. We know that sleep and exercise and stress relief also helps us do that. So I then proceeded to kind of like move all of these levers and put all of these pieces together so that my body, from an epigenetic standpoint, could just like really focus on how the environment can change the process to support less inflammation, more energy, better hormone function, and all the things that come with it. And that was the second aha moment, was that I wasn't metabolizing hormones well, and I needed to understand that. The third aha moment was the chronic inflammation piece. And I knew that if the gut had inflammation, if I wasn't circulating hormones well, there was this chronic low-grade inflammation that we know over time contributes to so many disease states. And it's why 60% of the population over the age of 21 has at least one chronic disease. We're seeing that in the population. So this concept of inflammation is something that I need to check on every level of my life, not just how I ate, but also the products that I was using, and also like the toxic burden that my body was amassing, and if I was able to support that and how. I was a gal at one point in life who had like 10 different perfume bottles of like all different types of, like
all the options.
Oh my gosh, there's so many options out there. And I didn't even want to donate them or give them away, because once you learn about what's in them and how, they are hormone disrupting, they are toxic chemicals in them, I just threw everything away. That meant opening up all the cabinets, the cleaning products, the dishwashers, shampoo, conditioner, the nail polish, the makeup, literally looking at everything and thinking, wow, my toxic burden is really bad. We know that like we're 200 to 300 chemicals that we're putting on or in our bodies every day, many of which are harmful. And so of course I had to just, again, take inventory of my life and look at all these products and make better choices and better decisions about what I was going to put in and on my body. And that was a game changer too, because then I thought, okay, how else can I continue to decrease inflammation? Let me take away as many things that are toxic burdens and try to release myself from that. Let's focus on anti-inflammatory foods. Let me think about how I'm sleeping and if I feel restored and what my energy is like. Let me get my checkups and learn about my data. So it ended up becoming more of this holistic, multi-pronged approach to healing from cancer. And it still continues. It's still something I continue to do.
Ongoing, lifelong journey.
Yeah.
I love what you said on all of those, and how even as you were mentioning the toxins at the end, there's such little education about all of this. Most of us are living in this world, and unless we do a lot of our own research or we happen to talk to someone who's educated, we wouldn't know. We're just doing the normal things that normal people do and buying products that are sold in the stores. So there's so much that we really have to do to further spread this education.
Yeah.
What about this experience and the impact on you on, I would say maybe like your emotional health or your way that you view life? I think anytime, I'm always so interested to talk to people who've been through really difficult, life-changing experiences and how that changes their outlook or their, just like how they see themselves.
If there was more time, we would talk about like a dozen other things that were so helpful on that breast cancer healing journey, which continues. But I think I at least hit on like the three most important. I would say that the emotional and spiritual development as I continue to get older is something that I'm still cultivating. It did take a lot of unpacking, and the healing journey still goes on when it comes to looking at my childhood trauma, looking at things that have happened throughout life that also just made me question who I am, and really focusing on my purpose has just given me so much gratitude. I don't, in the past, I never was somebody who like stopped to think about all of these things. But now that I'm in my early 40s, I'm thinking hard about all those things.
I think that's part of the evolution of life, right?
Totally. And like, even from a work perspective, intuitively, I go by my energy and how it feels on a daily basis. So I'm thinking about how I feel after I sleep. Sure. I'm thinking about how I feel when I'm around certain people. I'm thinking about how I care for my patients and what my energy is like there. and what continues to inspire me. So whenever it doesn't feel right, I also respect that too. And now when I'm looking at life, it was less so much about all of these things that have happened and more about just embracing who I am now and who I continue to become. And less judgment on this girl, So I'm working on it, but that's certainly something.
Yes, we all are. And I think there are certain things that happen in life to maybe help us ask those questions or dig deeper. And while I haven't had a breast cancer diagnosis, I've had things or moments in time that force me to look at those questions. And I think it is, for so much, especially going through medical school, for so much of our lives, we are just numbing and trying to do what we're supposed to do to get to the next step or get to the goal. And then there comes a point where, and you start really tuning into your energy, like you said, your energy, how you feel. If someone would have said that to me when I was in med school, I would have said, "What are you talking about? This is just what I'm supposed to be doing right now."
Yeah.
And so it's an ongoing, evolution that's really beautiful to see you live and share with your patients and continue to evolve. And speaking of which, now you get to do a lot of that in your job here at Love Life. So we just took a tour before we started this conversation, and you showed me all around. And I was telling you, it's amazing to see what's happening here, because when I was in med school, I was also spending a lot of time in CrossFit gyms. And I remember having the thought after I did not work in a primary care office before med school. So I was spending time in primary care offices during that first year and seeing, wow, people really are not getting healthier here. They're just needing more medication and increased doses every 6 to 12 months. But in the CrossFit gyms, people are really getting healthy and they're coming off medications and changing, they're gaining confidence and losing weight and all of these things. And the 15-minute office visit is just not the environment to create health. Health is created in our communities. And what's happening here at Love Life is bringing that truly to life with this collaborative environment around not just fitness, which you would get in a gym, but connecting your fitness or how you move, how you eat, actually to what's going on inside your body with the medical care that you are providing and how collaborative that is. So maybe will you just tell us a little bit about how you first heard about Love Life, how you got involved, and what it was that drew you in to say, this is where I want the next chapter of my career to be?
So Love Life is this holistic health and wellness club. We're located here in El Segundo, and we've brought in multiple modalities of healing in one place where patients can really feel that from a community level, but also have that on a medical level as well. And when I was first considering the opportunity, I was thinking bigger. And I was also thinking like where I was in life in terms of how I was currently practicing. And I decided to take the position in early 2024, so early last year. When they approached me for the idea for what they were trying to cultivate, I love the doctor and health coach setting. And that was where I was practicing for many years. I love that setting. I love the concept of root cause, of spending more time with people, not 15-minute appointments, but hour-long appointments, helping them understand their body in a way that was going to inspire them to continue to move forward on whatever health journey they're on. And the idea of bringing this kind of medicine with the longer appointments, with the root cause, into a beautifully curated ecosystem of fitness and nourishing foods and the best recovery modalities and a team of experts, to me, that was like, oh my gosh, that is something that I would love to be a part of. It was such a delicate time because I was also newly pregnant. And an interesting fact about the opportunity was I was deciding, gosh, do I tell, I'm about to take this, I'm about to take this job.
Right.
Do
when
I
tell them?
When do you tell them? So scared. And I said, you know what? This is who I am once again. And so let me just tell them. And, they had given me a verbal offer as an opportunity. And they said, we'd really love to have you help support and help lead this. And I said, I just want to let you know that you are opening this incredible facility at a time, literally to the day that my baby is due. And I am pregnant. I'm very pregnant. and this opportunity, as incredible as it is also just tough timing for me, because I'm about to have this baby that I've been through several years of infertility post-cancer. And so I said, like, this is my 150%. Like, I really need to hone in on this. I got to put everything into COA and, just getting through that experience. And so I said, if this isn't the right opportunity, or maybe you have like another candidate or whatever the case may be, I get it, because I really need to focus on this pregnancy. They came back a couple days, Julie, and they said, no, you're the right person. This is the right opportunity. And so we're going to support you and find ways to help so that you can still consider us and still take this position. And then I just knew. I was like, this is it,
Your people, yeah.
These are my people.
These things that things that you have to navigate as a woman that are so challenging, like you mentioned, being, when do you tell them, what do you say? And to then have a company be so receptive and interested in you, right? Like what you said.
Yeah, I was so grateful for that.
Really good, yeah.
And so throughout my pregnancy, up until I decided that I really wanted to focus in on, the last trimester and getting ready for maternity leave, I've been back at Love Life for about 90 days. The best part that originally, to go back to your question, what attracted me was that dream of, being in the medical space and in people's journeys, but having all of the experts in a collaborative experience. That was a dream of mine. And maybe it's not every doctor's dream, but it was of mine. And being able to do that in a way where we can learn from each other. I'm learning from our traditional Chinese medicine doctor. I'm learning from our Reiki and energetic healer, our registered dietitian. I'm learning from her. I'm learning from the health coach and the physical therapist and the person's unique trainer, etc. Right? Like, we have created an ecosystem where our patients are able to get this blend and this fabric of all of these different experts in one way, which is what we're creating at Love Life. And from a community standpoint, they're also just in this beautiful 45,000 square foot space that also is supportive of collaboration, of education, and free community offerings that we do. The nourishing food, so that whenever you eat it, you just know that everything that we've curated and put together was done thoughtfully. The recovery modalities, we brought in red light and cold plunge and cryo and infrared saunas and dry sauna. We've brought in as much as possible to support how people recover and rest and heal. And then, of course, the latest in fitness equipment. So to me, when I thought about this ecosystem that Betsy Foster and John Mackey and Michael Robertson were envisioning, it was just, the timing, and this is where my heart is, but I'm also having my baby. And now I kind of feel like I have two babies.
Yes. You have twins, basically.
So Koa is 6 months old, and I've been back at Love Life for 3 months, but as our team continues to build community, I only see this type of medicine and this model of medicine to continue to thrive with time.
That is so beautiful. And I can feel that being here. Like, everything is under one roof. Like you mentioned, all these different modalities, but also I can feel the collaboration amongst all of the different practitioners. Like you mentioned, for people who are members, they have access to all of this. And then they have, their physician who can help them coordinate, well, what's really needed and best for you based on your symptoms, your data. And you're talking to all the other practitioners. So you guys literally get in a conference room and say, okay, how can we best support this person? And even you mentioned with the physical therapist here is talking to the trainer. So there is this amazing collaboration happening amongst all the modalities, which is incredible when you think about how do you really truly create a space for healing. I think so often it's difficult for patients to navigate, even though there are a lot of opportunities now to find all different types of practitioners and all different modalities. It's sometimes hard to piece that all together. And sometimes, one practitioner learns something that's helpful for another and vice versa. So I think that's so beautiful.
Thank you. We're so proud of what we're creating, and it certainly takes a village. It takes a team, It's never just one of us. It's really all of us working together to collaborate for our members. So thank you.
That's beautiful. And I love that there's a little something for everyone. So maybe, you're not ready to be a full member, but you can come in the cafe and have something, or you can, work out, have a gym membership, or, there's community events. I know you're hosting several coming up where people can come by and learn about, interesting new topics. So it just seems like a cool place to hang out.
Thanks, Julie.
I love it. And also have to say congratulations on COA. I know maybe we'll do a follow-up episode sometime in the future talking more about your infertility journey and pregnancy, but beautiful. I love that you also were so open about that and sharing with, all along the way on social media. And I think that, again, makes you so relatable.
Oh, thank you. Thank you.
So as we wrap up, I would love to ask, there's 3 questions I ask at the end of every podcast. First one is, what are the 3 things that you do on a regular basis that have the biggest positive impact on your health?
Oh, what a great question. Something that has really changed my life in the best way was to understand how I breathe. And then a non-negotiable for me is always sleep and staying hydrated. Those are like 3 non-negotiables. So let me go back to the first. I didn't know that I was somebody who was such a shallow breather.
Mm-hmm.
And then in stressful situations or in different encounters, when you start to really closely pay attention to how you breathe, I was like, oh my gosh, this is like 90% of my day. And so learning more about breath work, I used programs from 5 Sense Collective and also XPT to learn the physiology, because again, you love root cause. And so you're trying to understand that better. And paying very much close attention to my breathing patterns and what impact that has, just as equally as I'm seeing my patients or not, when I'm doing my administrative stuff or engaging in conversations. And so really paying close attention to my breath was also on the list. The sleep, because in cancer world, in integrative oncology, we often use melatonin for its dynamic healing abilities. And for some people, they're also taking like therapeutic doses of melatonin. Obviously, there is science to sleep. And so, as a non-negotiable, really like respecting how much sleep that I need, and also making sure that I'm getting enough at the right times, and really focusing on getting outside as much as I can during the day to help my body align its circadian rhythm. I do write a lot about that. And I think that's important for all of us as human beings to really understand that, especially in the world of hormone health, because, I love talking about hormones and educating patients. As physicians, we constantly talk and think about the feedback loops of hormones from brain to ovaries or brain to thyroid. But where does the initial signals happen to the brain? It starts with how this person is sleeping and whether or not their circadian rhythm is fully aligned. That's where the original inputs are. So sleep to me is something that I always protect. And when I was going through chemo, it was so hard because I wasn't getting great sleep from everything that was going on. But to this day, like really prioritizing that and dialing in on a good sleep cycle is always at the top of that non-negotiable list. Hydration has always been in the past a struggle. And when I did that self-reflection post-cancer, I'm like, wow, I really am not hydrating well enough. I'm not sweating enough. I'm not moving enough. So then I had to really take a step back and like look at all of that and make sure that I was supporting my body with all of that. The water bottle is always there. And it's not just about like leaving it by your desk, but it's like just taking a step and, collecting, making sure that you're breathing and you're like, okay, I really do need to hydrate my cells because I want everything to function really well. So good, clean water goes a long way. And, so many of our patients always struggle with the hydration. And yet it's just one of those really simple things that if you continue to do this on a daily basis, it also just better supports your body in every way. So I could go on, but those are 3.
I love it. Those are 3. What is one thing that you have a hard time implementing? Something you know would have an impact on your health, but it's something you struggle with or something you're working on?
Yeah, good question. One of the things that I've struggled with in the past, and I still struggle with today, is I'm really passionate about my work. And so, really setting the boundary of turning that off, and then also focusing on being present for family, for Koa, for my husband, for me, that's an ongoing battle because I love the work and love what I do and I'm really passionate about it. But then I'm also trying to create this balance for family and for myself. So it's an ongoing thing that I'm working on.
Ongoing thing. Well, it seems like you're doing amazingly, especially with 2 babies this year. Last question is, what does a healthy life look like to you, Jaclyn?
Oh, a healthy life looks like every day waking up and feeling as though you have purpose, that you have community, and that you're engaging in self-care practices that make you feel joyful. Doesn't matter where you are or who you are or what phase you are in your health journey, but those 3 things will go a long way as you're kind of moving through that health journey. And that's always been super important for me too. So
beautiful. Beautiful. Well, where can people find you if they're looking to learn more about you or about what you're doing at Love Life?
Yeah, so you can find me, I'm pretty active on Instagram. So you can find me at Dr. Jaclyn Tolentino. I'm also at Love Life. So Love Life's Instagram, you'll also see a few elements there at theofficiallove.life. I have a website. So does Love Life have a website as well with everything else that we offer. And then I typically use Instagram as more of a scrapbook kind of thing where, I was a hardcore scrapbooker in high school and college. And so I think of my Instagram feed and the stories as being like a scrapbook of things that are going on in life, that I can also share and give some glimpses of education and so on. At Love Life, we also have right now our longevity learnings, our longevity lesson series, and free to the community for anyone to come. We have 6 more left in this particular series. And it was just an opportunity for us to bring members and non-members alike who want to learn about these different health topics. So I've broken that down for people where we have some education and we have thoughtful conversation and people get to ask questions and meet everyone else. And so it's been really beautiful. We've had a couple of them and that's every Wednesday here.
Very nice. Lovely. Well, thank you again so much for the time and for sharing so much of your story. And I'm so glad that you made that decision, that you wanted to share more, because I think we all learn so much and realize that we're all, everybody goes through things that are challenging, things that are exciting, and, we're all here to help each other. So I'm so glad that you have used your challenge to then, spark your changes in your career and how you help patients and now what you're doing here at Love Life, and grateful that you're sharing it with all of us. So thank you.
Thanks, Julie.
Thanks so much for tuning in. If you enjoy listening to the podcast, please consider subscribing and giving it a 5-star rating on iTunes. It really does help to get the word out to more people.